Thank you. It's a real pleasure to welcome you all to Birmingham and also to talk about Pioneer, our hub in acute care. So I always start by explaining what acute care is, because it's a little harder to grasp maybe than an organ. It's not an eye, it's not a lung, it's not a gut. Instead, it's a vital component of healthcare that looks at unplanned healthcare contacts. And it's a huge area of medicine and surgery. Each year, there are over 110 million acute care contacts in England alone, and the numbers are rising year on year. This has huge significance for the NHS and how it operates, but also for healthcare services globally. At any time, about 85% of hospital beds, often higher than that, are filled with patients that have unplanned healthcare contacts. It's an area of known health inequalities. So some parts of our community, particularly those that are poorest or who have difficulty accessing healthcare services, rely on the front door of hospitals for all of their health needs. And this increased demand places huge pressures on hospitals to deliver planned healthcare services. It's an area that needs vital innovation, and it needs it from researchers and companies, NHS providers as well, to come together. But it's been a hard nut to crack in terms of improving healthcare. We need better tools to guide therapy, to predict disease, and for treatment pathways, and to monitor disease. So it's a fantastic arena to see improvements in healthcare. The vision of Pioneer remains as it was when we were founded, because this is as relevant now as it was when we set out in 2019. We believe that access to highly detailed, individually linked health data, including synthetic data, supported by expert consultancy, can transform healthcare for our population. And our aims are to improve the health and well-being of our patients through responsible and patient and public endorsed data sharing under license with supported analytics and consultancy. So what do? We are an ethically and CAG-approved secure research database and analytical environment, meaning that we can provide overarching ethical approvals for research studies that go through our processes. We link patient data at an individual level across community and hospital healthcare providers, and we're disease and organ agnostic. That means we don't mind why you had an unplanned healthcare contact, be it a medical emergency, a surgical emergency, or trauma. All of that comes into our remit. The data is near real time and frequently refreshed, and we have the ability to build bespoke data sets so that you can then really choose the data fields that are required to answer the questions of relevance. We have a private cloud-based system using Microsoft Azure, which has been cybersecurity tested, and we can build bespoke trusted research environments to house data for analysis. Really important is that we provide transparent public oversight through our Data Trust Committee, who see every request that goes through us and also have that veto. So they have to support a data request for it to be supported. And we provide data under license to NHS, academic, commercial, policy, and third sectors. And I'm going to pass to Susie to talk about the technical side of what we do.
Thanks, Liz. So I have the unenviable job of summarising a lot of incredible work in a short period of time. So in essence, we have managed to provide data for acute care for 4 hospital sites, but also then we have 153 other acute sites as well. But all of this, as you can see, and I'm not going to read them out, you'll be glad, but it is all about that sort of medication, your presentation, so we can get that really rich longitudinal data. As Liz says, we created a trusted research environment and a safe haven on the cloud. And we really wanted to make sure that, as Liz said, it was cybersecurity tested so that when we actually sort of talk to our patients, we can be really clear that it's actually safe and secure. We've set up several different sorts of TREs. So we have ones that are just completely unique, but also ones that for SMEs and academics, they're able to then share that to reduce the cost. But all of this we've linked with our industry partners, our academic partners, to make sure that the tooling, as you can see up there, really fits with what industry and academia need. So what is our offering? We have many different offerings, and we've worked, and actually I'm really pleased to announce that we've sort of done over 60 different projects with a range of SMEs, pharma, medtech, etc. We offer data as a service, and really with the partners that are involved, we have real expertise around our health data, and we can really sort of support you along that journey, because we believe it's a partnership when you actually sort of apply for data access with us. We also offer consultancy as a service, and again, this is something that really, when we sort of support you, we go through that journey alongside you, and we really bring that sort of expertise to bear. And also, more importantly, and I think Hilary from Insight touched on it, it is about the community. It is about this idea that we bring that knowledge together, and you've sort of heard already, Pioneer's sort of been working with the other hubs, including the sort of synthetic data that we did with Breathe. I think, being the sort of last hub to present in this arena, but I think the theme has been throughout all of the presentations, we really want to make sure that from the sort of trust and accountability perspective, we have our data trust committee made up of, and we have actually sort of made sure we're not revealing the oldest member, so we did sort of suppress and say over 75, although at a recent event, one of them did actually sort of admit their age, but they at least consented to that. But you know, the thing about the West Midlands and Birmingham is we're really proud of our diverse community. And so it was really important for us at Pioneer that we made sure that Data Trust Committee was representative of our patients and our public. So we have got members who sort of come from BAME communities, and we've got many different sort of disabilities that we then sort of cater for. But as Liz said, a no means a no, so that is a veto if the panel don't agree with the application.
Quick handover. So the reason all of the hubs exist really is to improve care for our patients, both nationally and indeed globally. And so I'm just going to give the very briefest run through in terms of some of the case studies that we've been able to support, and I'm incredibly proud to do so. But what I would urge you to do is go to our marketplace stall, where there are brochures that outline these in more detail and provide you with a flavour of the kind of work that we've been involved in and how we're improving patient care on the ground. So this diagram just gives you an overview, and we're really proud of our successes to date. We've worked across multiple sectors, providing access to data from large pharma, medtech, medical device, healthcare consultancy, and SMEs. And Insight obviously spoke about the importance of supporting SMEs across our communities. To date, we've received more than 60 data sharing requests, and we've enabled data analysis by more than 250 data scientists across the UK. It is vitally important that we build a community of data scientists that understand health data, can get access to it in a timely way, with appropriate governance and oversight to answer important questions, and we're proud of the support we've given in that. And we have more than 45 platinum data sets on the Innovation Gateway, but that number's going up each month, so do go back and visit the Gateway to see what we have, and we also can create bespoke data sets for you. We've supported more than 20 academic publications and have been written into more than £22.9 million worth of grant funding. That hasn't all come to us, clearly, but what it has done is supported the data science community and healthcare research across the breadth of this nation, and we're very proud of that. And we're also proud of the fact that we have lots of repeat business, so customers come back to us because they like the service that they receive. But the outputs are the most important thing. We've built and tested decision support tools which are now deployed in NHS services. We've helped change NHS care plans, and the insights have been shared globally. And some of the COVID work we've done, we're very proud to say, was built into infographics that have been shared across the continents and written into different languages. And speaking to people in different languages is very important. So our patient and public groups have co-written with us leaflets about health data, its use, and the choices people have in a number of different languages that have been road tested and built with our communities to make sure they meet our needs. I'm only going to give you a whiz through the next 3 slides to whet your appetite, see if I can drive you to the marketplace. But these are the kind of projects that we've been involved in. So we've provided image data to help with the analysis of X-rays during the first wave of the COVID pandemic when testing wasn't available. It's easy to spot a pneumonitis, chest problems, in somebody that has normal lungs, but if you've got lung conditions or heart failure, it's much harder, and the algorithms built help with that. We've also streamlined admission processes through same-day emergency care, SDECs. We've worked with our NHS partners to show which aspects of NHSE policies have unintended consequences across a population. We've worked with a number of grant organisations, and we're proud to be part of Admission and Optimal, 2 studies assessing multimorbidity. Because we look at healthcare in the round, we can look at all of the conditions that people struggle with in order to build a complete picture of the person. And we're very proud to be part of the DARE Sprints leading FedNet, which is looking at how we can embed federated analytics across the UK. Thank you very much.